It's my distinct pleasure to be able to talk to you about Dr. Jean Sumner. She is, I feel like she never needs an introduction, but I'm going to do my best to muddle through it. But she is widely known as an expert in rural health and a leading innovator in rural health because she cares so deeply. And anybody who hears her speak always says, my gosh, she's wonderful. I think it's because she genuinely cares about it. It's not a topic that she's just become an expert on. It's her heart. And I think you'll see that as she speaks to us. But she's always cared deeply. She's a third-generation doctor in rural Georgia. She spent her life practicing in Washington and Johnson counties before becoming the dean here at the School of Medicine in 2016. She came to Mercer as a community faculty preceptor in 1989, and then associate dean for rural health in 2014, and has held a succession of leadership positions over the years. She served as hospital chief of staff, nursing home medical director, as well as board member, chair, and president of numerous community and statewide professional organizations. At a statewide level, she served as a governor-appointed member, then president and medical director of the Georgia Composite Medical Board. In 2020, Dr. Sumner received the Ralph Claypool Senior Memorial Award from the American College of Physicians, and this is particularly a distinction because she's the first Georgian to ever receive that award. She's also a fellow of the American College of Physicians. Dr. Sumner is proud of her Bachelor of Science degree in nursing and Master of Science in Nursing from the Medical College of Georgia, and then she completed her medical degree from Mercer University School of Medicine. She completed her internal medicine residency at the Medical Center of Central Georgia, and it's my pleasure to be able to introduce her today to come speak with you as well.
Glenda did not clear that introduction with me. Thank you, Glenda. I just want to welcome you to Mercer, and just delighted to have you here and hope you'll come again. We are really proud of the work you do. The most important thing we can do for the health of Georgia, and I'm an internist, so take it for what it's worth, is have pediatric care in these rural counties. Pediatricians change the world. Their staff, you mean so much to your community. You affect the family's health. And so what you do is important. And our purpose in this is to try to bring you more resources, more education, but also to bring you the recognition that you so desperately deserve and the communities, the need in our state. I think 65 counties don't have pediatricians. Those kids deserve better, and I know how important you are. So I appreciate you very much. For those of you who haven't been to Mercer, Mercer just had, I think it's 186 graduation, 186, I think I'm right. We've been here a long time. The medical school was created in 1982 for our mission, and our mission is to train physicians and other health professionals for rural, underserved Georgia. We take that mission very, very seriously. We live it. Our research relates to it. Our service relates to it. Things you may not know, and I don't know if what Glenda said this morning, things you may not know about Mercer is we are an NIH Center of Excellence in Rural Health. We were one of the first 2 in the nation, and now there are 4. So we understand rural health and the things that go on there. We also are the leading producer of prosthetics in the world. Yet not the School of Medicine, School of Engineering makes a prosthetic. And I think Mercer has given away, I think I heard 1,800 prosthetics. Is that right? For free to people who lost legs for various reasons, including landmines. Our students get the opportunity to travel abroad and to go to states like, communities or counties like, countries like Vietnam and Cambodia and parts of Africa and other needy nations to fit those prosthetics and to do other mission work. It's not a religious mission, it's a health mission and an engineering mission. We do a lot of work around the world. People ask me often, if you have a medical school that trains physicians for rural Georgia, why do you think that's important to send them to a third world country? And there are a lot of reasons. You learn about service. You learn how grateful you should be to be an American because those countries are really in trouble, many of them. And when you look at some of the poverty in these countries, you see rural Georgia as a real opportunity. Healthcare can change rural Georgia, healthcare and education, and you're the guys that can do that. So anything that Mercer can do to help, we're open to helping. We like to hear from you. We like to hear what we're doing right and what we're doing wrong. And we'd like to know if there's a way that this school can help you. We only accept Georgians. We really only accept Georgians. We used to, before I came, they used to look at where their parents' tax returns were from. We don't do that now. But we have 100% Georgia. The average percentage, or the percentage quoted by the AAMC, American Association of Medical College, of medical students that grew up in a rural community is 4.3%. At Mercer, we approach 50%. We're between 40 and 50 every year, and we're 70% outside of metropolitan Atlanta. And that is not to say we don't like people from Atlanta. We do. They're just not going to end up in South Georgia. So our students are Georgians. They want to go home. They're looking for opportunity. Help recruit them. I say that every time I talk, because if you wait until they're in residency, it's too late. People are talking to them in their first year. They get to their third year and they go into a tertiary care hospital, and we have some great hospitals. But the doctors say, "You sure you want to go out there? You're not going to make any money. You're not." And all those are myths. That's not true. So we have to galvanize them and keep them interested. They care about their communities. They need a way home, and they need guidance to get there. We have scholarships. Every scholarship at Mercer is aimed toward going back to a rural community. So you can go to the medical school for essentially free. We have the Nathan Dill Scholars. We've given away, this year I think we'll approach $12 million in scholarships in the last 5 years. Free rides through Mercer. We have the Children's Healthcare of Atlanta scholarships for young people who want to be pediatricians and live and work in a small town. And Children's was gracious enough to give us 10 free rides for the next 10 years, 100 pediatricians that will be available to those communities that need them. We also were the first in the country to start an accelerated track, which means you can go to med school for 3 years and get out. And I'll say those students that do that, generally in the top of their class, they're really smart. It's the same curriculum. It's a little faster, but they get the same experience. But they pay 1 year of tuition and the next is free. And we have a match waiver. If you know what the match is, it's the Russian roulette of figuring out where you're going for your first job, for your residency. But our match waiver allows us to put them directly into a residency that they work with or in Georgia that we work with. So it's a 3-year program, and that's in pediatrics, family medicine, internal medicine, and we're going to add psychiatry this year. And they're all connected to rural. So thank you for what you do. I hope you know that Mercer's here for one purpose, and it's to help rural Georgia. So we appreciate what you do for rural Georgia, and I'm glad to talk to you or answer any questions if you're here. I'll be here for a minute, but I'll have to go back to my real job. So.
I do want to give a shout out. You have one of the first Nathan Dill Scholars here in the audience today, and she is a great friend of Mercer. Will you please stand up, Dr. Lord? We are so proud of her and the work that she does in the community, and all of our doctors, Nathan Dill or not, but we're awfully proud of Dr. Lord and all that she does for us and contributes to us. So thank you.
All right. Hello, everyone. Before we dismiss you all for lunch, we do want to show one of our poster presentations from one of our children's scholars, Tre Steele. He is a second-year med student who has received our Children's Healthcare of Atlanta Rural Pediatric Scholarship. So, Tre, let me pull up your slide.
Oh, very good. Thank you. All right. Well, good afternoon, everybody. Since I am between you all and lunch, I will not take too long. But as Harvey said, my name is Tre Steele. I am a second-year medical student, rising third year, and I'm also a proud Children's Healthcare of Atlanta Rural Pediatric Scholar. So the title of my project is Adherence to Care in the Medicaid Population and Potential Long-Term Effects of Missed Well Child Visits. My focus on this project was understanding why Medicaid patients miss pediatric appointments, specifically missed well-child visits, and then possibly identifying solutions to improve care adherence. Okay. So as we all know, well-child visits are essential, especially in those first 2 years of life. The AAP actually recommends about 9 visits within that time frame, and these visits are key for things such as vaccinations, growth and developmental monitoring, early health issue detection, and parent education on nutrition, safety, and overall general health education and knowledge. So some potential consequences of missing these well-child visits. Missing well-child visits leaves children under-immunized without timely developmental screening. Empirical studies have linked missed well-child visits to higher acute care use. Children who skip well-child visits have increased odds of emergency room visits and hospitalizations. On a population level, low well-child visits can translate into outbreaks of vaccine-preventable diseases. We see developmental delays, lead poisoning, and chronic conditions such as asthma and obesity that can go undetected for a long time. So in summary, missed well-child visits leads to missed opportunities per preventative care. So how does this relate to rural medicine? Well, in rural Medicaid, children specifically faced magnified challenges. They have consistently lower adherence. Only around 47% of enrolled Medicaid rural children had well-child visits in 2019, and that's versus the 56% of urban children who had well-child visits. Contributing factors included greater travel distances to clinics, scarcity of pediatric providers, and limited broadband telehealth needs. Targeted outreach, such as mobile clinics, telemedicine, partnerships with schools or public health is especially important in these areas. So what are some of those barriers that were recognized? So families and providers report numerous social and structural barriers. Common themes included things such as lack of transportation, inflexible work schedules, limited childcare, financial stress, language and health literacy barriers, immigration concerns, and low trust in the health system overall. Additionally, provider shortages, as I mentioned earlier, are a big issue, and clinic hours that conflict with families' availability to get the child to that appointment have also been shown to be an issue. So we know the issues. What are some possible interventions? Well, unfortunately, there isn't no one say-all be best, solution to fix or to make adherence 100%. However, multifaceted interventions have been shown to increase well-child visit rates. Things such as automated reminder call systems, so call and text, have shown to significantly increase scheduling of upcoming well-child visits. Integrating literacy promotions such as Reach Out and Read programs have also boosted attendance. Other promising strategies include providing transportation vouchers, flexible clinic hours or school-based clinics, community education always, and then even embedding reminders in electronic health records have been shown to increase well-child visits. So that is was my presentation over the summer. If you have any questions, feel free to ask. I'll let you guys get to lunch.